So trauma, if you look at the origin of the word, it explains what it is. Trauma is from a Greek word for wound or wounding. So trauma is an injury. It's a psychic injury. It's a psychological injury. It's an emotional injury. Now if you look at a wound, and what are the characteristics of a wound? So first of all, if you have an open wound and if you touch it, it really hurts. Trauma is not what happened to you. Trauma is what happens inside you as a result of what happened to you. So there's a traumatic event, and then there's the wound that you suffer. The wound is the trauma, which is a good thing. Because if the trauma was what happened 10 years ago or 30 years ago, there's nothing you can do about it. It happened. But if the trauma is the wound that you suffered, the wound can always be healed. So, trauma, first of all, is an unhealed wound that when you touch it, it really hurts. So somebody says the wrong thing to you, and if you're traumatized, you'll react like you're being hurt all over again. It's like if you had a wound on your shoulder and you tapped it like this, it would really hurt. If there's no wound, if you tap yourself, it doesn't hurt at all. So trauma is this open, unhealed wound, on the one hand. On the other hand, what happens with wounds is you get scar tissue. And the nature of scar tissue is that it's hard, it's rigid, it's not flexible, and it doesn't grow, and it doesn't have nerve endings, so it doesn't feel. So on the one hand, trauma can show up as very sensitive wounds, and in the same person, they can show up as areas where there's no feeling, there's rigidity, no flexibility, and no capacity to grow. So that's what trauma is a wound like that. Now, when you're hurt as a child, the way you can protect yourself, you can't run away and you can't fight back. As a 2-year-old, as a 3-year-old, you can't. So what you do is you disconnect from your feelings and from your body, from yourself. So the essential trauma is that disconnection from yourself, which again is a good thing, because as long as you're alive and conscious, you can always reconnect. But that disconnection causes many, many problems, both mental and physical, until you heal the wound. Now, trauma can show up in two forms. One is the big T, we call big T trauma, which is sexual, physical, emotional abuse, a parent dying, a bad divorce, a bad family atmosphere, a parent being mentally ill, a parent being addicted, violence in the family, a parent being jailed, so separation, neglect. These are the big T traumatic events, and they happen to a lot of people. But there's another way you can hurt kids, which is not by doing bad things to them, but by not giving them the good things that they need. So children have an absolute need for unconditional, loving acceptance, being seen, being heard, being accepted for who they are. The parents may completely love their children, but if because of their own trauma, or their own stress, or their own issues, or their own difficulties in the world, if they're not able to give that child that unconditional, loving acceptance, being seen, heard, the child can still be wounded. That's what we call small T trauma. So those are the major impacts of trauma, and the main characteristics, and those are the two types of trauma that I talk about. But essentially, it's a wound that you sustained when you were small and couldn't do anything about it. I passed my trauma on to my kids. So that one of my traumas, as a result of what happened to me as an infant, is that I didn't believe that I was lovable. So then I had to go and prove to myself that I was lovable and people would love me. So I became a doctor. And I'm always accepting more patients. It doesn't matter how busy I was available day or night, stressing myself. Meanwhile, I have young children. It doesn't matter if I feel love for them, which I did, but if I'm not there, or if I'm too tired when I'm with them to give them the attention they need, what's the message they get? They get the message that they're not lovable. So this is how we pass it on. We don't mean to, but we do. So trauma is passed on largely, when it's not resolved, when it's not healed, we automatically pass it on to our kids. We don't mean to, but we do. First of all, that recognition is the first step towards healing. So, until I realized that I was carrying trauma, I couldn't heal. So that recognition is the first step. In fact, it's the most important step. Well, healing actually in English comes from the word whole, wholeness. So remember I said that trauma is, there's a disconnection from the self, so become separated. So healing is becoming whole again, where we're not disconnected from our body, where we're not disconnected from our emotions. That's the healing process, or that's the healing outcome. How do we get there? Well, it's work. There's a lot of different ways. I could name some of them, but there's a lot of different methods, different approaches, some of them psychological, some of them working just with the body, some of them involve some spiritual work, but it all has to do with coming towards wholeness. And sometimes, if I may add, when people suffer a crisis, or they suffer an illness, or they go through a bad divorce, or they find themselves dissatisfied with their work, then they start asking themselves, well, how did this happen? And that question is the most important question. In other words, not why did this happen to me, but what is it in me that may have helped this to happen? So the healing does begin with taking some responsibility. Not guilt, but responsibility. What happened in childhood happened, but it's in the present moment, it's my responsibility to do something about it. So I would say it's asking the question, and then secondly, taking responsibility for the healing. Those are the most important first two steps. Well, first of all, just take the word depression itself. What does it mean? So in English, at least, to depress something means to push it down. So what is it that gets pushed down in depression? If you ask anybody who's depressed, it's not a feeling. Depression is not a feeling. It's a state of mind. It's a sense of being flat and kind of meaninglessness and loss and discomfort and a sense of lack of hope. But underneath all that is the pushing down of your emotions. So why would somebody push down their emotions? Only because in childhood they learned that to experience emotion was more painful or more dangerous than not to. So that even the depression can be a teacher. So if we ask the right questions, the depression doesn't have to be a barrier. It can be actually a sign that guide you towards healing. No newborn baby doesn't know how to ask for help. They know how to ask for help. They're hungry, they're tired, they're lonely, they're uncomfortable. They know how to ask for help. They cry. So it's not a question of how to learn something, it's why did we forget how to ask for help? So we forgot to ask for help because we learned that to fit in with our environment, it's better not to ask for help. Because to ask for help is to invite criticism, or our parents are too busy and too stressed, so it's too painful to ask for help, so we forget how to do it. The Greek playwright Aeschylus, in one of his plays, the Agamemnon, he said that the way the gods created human beings is that we have to suffer into truth. So the suffering, whether physical illness or mental distress, can actually be a teacher. Many people, once they realize how much they're suffering, they will ask for help. At some point they will ask for help. Those that don't know how to ask for help at all and they're afraid to, they're in trouble. But I would say, for the most part, if I'm an example, when life doesn't work the way you imagined it ought to, we start asking questions. And difficult as it is, we ask for help. And when you first go for help, it's very difficult. It's true. But if you're suffering enough, and if you don't want to suffer, you'll probably ask for help at some point. Pretty much every time you get upset, 95% of the time, it's not the present, it's something about the past that has you upset. Like, for example, 2 weeks ago I was traveling from Portugal to England, and the flight was cancelled. Okay? Now, maybe 5 years ago, if that had happened, I would have been really upset. And, raise my voice and argue with the airline employee who was telling me the bad news, Now, okay, I got it. It was cancelled. I have to sit and read my book for the next 10 hours at the airport. Okay, but no big deal. Now, what was I upset about? Not about the fact that the flight was cancelled. That's disappointing, but it's not necessarily upsetting. What is the upset all about? That my needs aren't met. Well, when did that happen, that my needs weren't met? When I was an infant. So what's happening in the upset with the airline employee, who's just doing her job, trying to help me actually, is I'm projecting my infant frustration. Why is this happening to me? It's not just happening to me, it's happening to 200 other people at the same time. So most of the time we get really upset. That's a good sign that this is trauma showing up. Most of the time. Not always, but I'd say, especially in your personal relationships, with your partner, your friends, your children, when you get upset, really upset, it's a really good time to see what's really going on here. So it shows up that way. It shows up in, I got fired from a job once. It was wonderful that I was fired. I learned a lot. But at the time, I was really upset. And I was so angry. And I was so outraged. Until I actually examined it, and I realized, you know what? I created my own firing, the way I was. I was doing a good job, really good job. But my colleagues, who were more traditional minded than I was, they didn't understand why I was doing things the way I was doing, even though they were working. So they asked me questions. Now, when somebody questions me, especially in a certain tone of voice, I'm not hearing a question. I'm hearing an attack. When I hear an attack, I become like a bulldog. And I bite back. That's why I ended up being fired. But at the time, all I could see is poor little me, a victim, When I thought about it, no, I created it. And it was a beautiful learning. So my trauma showed up because I thought that by asking questions, they were invalidating me. Now, if I fully believed in my own value, if they asked me a question, why are you doing it that way? I'd say, oh, I'm doing it that way because this and that. But if I don't believe in my own value, which is my trauma, then when they question what I'm doing, I perceive that I'm being attacked. So there's all kinds of ways that trauma shows up, and we can learn from it all, if we're open-minded about it. Well, I just came from Palestine. I spent 5 days there. And the trauma there is unbelievable under the occupation. And it's showing up in a sense of helplessness, in a sense of hateful rage, but not a helpful rage, but a hateful rage, which I can understand, but it doesn't help. It's showing up in people turn on each other sometimes to take out their frustrations. in Israel, it shows up that this terrible thing happens to us Jews, and we'll never let anybody do that to us again, and we're going to be the strongest, and we're going to be the one who has all the guns. So it shows up in the oppression of another people. So it can show up both in the perpetrator, and it can show up in the people who are suffering it. And in both cases, there's collective trauma. I'm not making them equal, by the way. They're not equal. But it's showing up in both. And in Israel, it's also showing up in, we're not even going to look at what we're doing. We're not even going to question it. And the people who are questioning it are seen as traitors. So trauma shows up in politics. This is, by the way, not unique to Israel. It shows up in Canada. In Canada, our indigenous people, the native people, they suffer a lot. They have a lot of illness, suicide, addictions, sexual abuse of children. They never used to have those things. Never, ever. Until colonialism happened. And there was a deliberate attempt to destroy their families. Their children were abducted, sent to residential schools, run mostly by the church, where they were abused physically, sexually, and emotionally, and culturally. The result is the transgenerational passage of trauma. So in Canada, indigenous people make up 5% of the population, 30% of the jail population. And 5% of the population, 50% of women in jail in my country are indigenous people. That's a sign of collective trauma. But the culture that's doing it to them, there was a poll done in Canada last year in June. They discovered hundreds of bodies of native children without graves close to these residential schools. And 2 weeks before they found these bodies, the first bodies, they found more since then, but 2 weeks before they found these bodies, there was a poll done in Canada, an opinion poll, and 70% of Canadians said they knew nothing or little about the residential schools. No, people are in denial of reality. So denial of reality is a sign of trauma as well. So there's trauma on both sides. I'm not making it equal, because one side is made to suffer a lot more than the other. But denial itself is a sign of trauma. It means you can't stand reality. It shows up in culture, in politics, in sports. In sports, most people know much more about the strategy of Manchester City or Liverpool football teams than they know about Iraq or Afghanistan. Yet they send troops to Iran and Afghanistan to kill people and to be killed. Well, what is that? Why is it more important to most people which football team scores the most goals or which player signs with what team than what's happening in the real world? Why are people more concerned about what Princess Meghan did with Prince Andrew, or what color eyes their children have? Why is that more important than what's happening to the climate? It's a sign of denial. It's a sign of trauma. It's a cultural denial is what it is, which is a sign of collective trauma, I would say. So Western medicine does not have an approach to trauma because it doesn't even recognize it. The average medical student, you might find this hard to believe, but the average medical student doesn't hear a single lecture on trauma throughout their 4 or 5 years of undergraduate education. Nothing. Not one. Even though, from a clinical and from a proven scientific point of view, there's a huge link between childhood trauma and adult mental and physical illness. So for example, a Canadian study showed that men who were sexually abused as children have 3 times the risk of heart attacks than men to whom it didn't happen, not because they smoked or drank, but just because of the trauma. Because the trauma actually causes inflammation in the body, amongst other things. Many studies have shown a relationship between childhood trauma and autoimmune disease, childhood trauma and cancer, or trauma and cancer. A study 3 years ago, published in a major medical journal, showed that women who suffered PTSD, post-traumatic stress disorder, severely, they had double the risk of ovarian cancer, which means that what happens emotionally has a significant impact physiologically. And what's frustrating about it is that these studies are published over and over again in scientific journals, but most physicians are not aware of them. So if you go to a specialist with your rheumatoid condition or your malignancy or your asthma or your skin inflammation or your neurological disease like multiple sclerosis, or your joints are swollen and inflamed, they will deal with the biology, but they don't recognize that the biology is connected with the psychology, and that very often that's connected to, for example, multiple sclerosis. Well, let me tell you a story. The first person who described multiple sclerosis was a French neurologist called Jean-Marie Charcot in the 1800s, middle to late 19th century. And he said that this disease is caused by long-term grief and stress. He said that. He saw it. Now, since he made that statement 150 years ago or so, there have been multiple studies showing the relationship between childhood trauma, long-term stress, and multiple sclerosis. But the average person goes to a neurologist with a flare-up of their multiple sclerosis, all they get is medication. Nobody asks them to look at the stress that may be causing the flare-ups. So scientifically, the unity of mind and body has been established for a long time now. In research, thousands of research papers showing the relationships, and the average physician is completely unaware. That's the nature of the medical ideology. It's brilliant, it can do amazing things in certain areas, but when it comes to chronic illness and looking at the connection between the individual and the environment and the mind and the body, there's almost complete blindness and deafness. So that's how it works. And it's very frustrating, because if we saw these connections, there's so much more. If you saw these scientific connections, there's so much more we could do for people. There's so much more we could do. So I've been writing about these things for about 20, 25 years. There's much more interest in my work now than there was 10, 15 years ago, including on the part of many doctors. There's a book called The Body Keeps the Score by Dr. Bessel van der Kolk on trauma. He's an American psychiatrist. It's a big international bestseller. That's a sign of something. So I think it is changing. And more people are recognizing it, including more and more physicians. But institutionally, it hasn't happened. Institutionally, I think it's going to take a long time, because the medical profession is a very conservative profession. It wants to maintain things as they are, or it wants to keep the changes within certain predictable or acceptable channels. And to go into this broader, holistic, scientifically holistic perspective is to actually demand that people completely change how they understand illness and health. People are difficult to shift that way. And also, let me tell you, medical education is very traumatizing for a lot of people. And the people that go into it are like me. They're very driven people, just determined to do it no matter what. So we put ourselves through this very difficult training. We are already kind of driven to succeed. And nobody tells us to look at ourselves. And so we don't have the eyes to see. And I can tell you studies that have shown that When you look at certain biological markers of aging and stress, if you compare medical students to other people their age, they age quicker. Their chromosomes suffer damage more than other people their age as a result of medical training. So these are the people that I can understand that. I've been like that myself. So there's lots of there's one more thing. You know, we're talking in Basel right now. Isn't this where Hoffmann La Roche is based, the pharmaceutical company? Well, much of the research that reaches the eyes of doctors is funded by who? The people that make a profit. Who makes a profit? The people that sell pills, the pharmaceutical companies. Now, there's no profit. There's no pill for trauma. There's no pill for self-examination, for self-inquiry. But you can sell a lot of pills by dealing with symptoms. So the research is mostly funded by people who profit from not looking at the deeper issues. And that's the information that a lot of doctors read. So there's all kinds of strong reasons why, as a profession, physicians are unaware. No, there are individuals, many individuals in the medical professions who, like me, they start asking questions and they start seeing things that they were not told about in medical school. But as an institution, it's a very conservative and resistant and defended profession. In the medical model, I'm the doctor, I'm the expert, and I'm going to fix you. So I have all the power. But healing happens inside a person. So healing is a capacity of all organisms, plants, animals, human beings. It's an innate quality of the organism. I can help the healing, but the healing has to happen within the person, which means that the individual needs to take agency, what I call agency, needs to take responsibility and power over the decisions. Whether they accept medical treatment, whether they don't, they're the ones that need to decide consciously, not passively, but actively. There's great medical treatments around, but don't receive them passively. Choose them actively. Consider everything. And a lot of doctors actually are threatened, or they perceive themselves as threatened, when the patient starts asking questions. You talk to a lot of people who go to doctors. Sometimes the doctors are great and very patient, but very often they get irritated and defensive when you question what they're telling you, because they perceive it as a loss of power. And yet, the healing is an inherent quality of every organism. So people who are suffering with any condition, whether it's mental health or physical health, or just dysfunction in their personal lives, if they recognize that they have the power, and if the healers can help people recognize that they have the power, that's great. So if anybody's listening, to all those who are listening, I'm telling you, it's within yourself. You can ask for help and receive all the help that you think is necessary. That's great. But don't give up the power. It's yours. Well, the Buddha said it best. He said that when we know the cause of our suffering, that's a big step towards healing already. Those aren't the exact words he used, but that was I forget the exact words, but that was the meaning. Healing has to begin with asking the right questions and looking at, well, for example, people with multiple sclerosis or rheumatoid arthritis, they have trouble saying no. Typically, they have trouble saying no. They're more concerned about pleasing people and being nice. And that's very stressful. Suppressing your anger, so you're always very nice and smiling and always looking after other people, thinking about other people's needs and not your own. That's very stressful. No wonder it leads to flare-ups of illness. But nobody's born like that. They were programmed. Something happened in childhood. but they learned that to survive, that's how they had to behave. Now, it's important to recognize that this niceness and this being kind to others but not being kind to myself, that's not who I am. That's just a mechanism that I adopted to survive my childhood. But I'm not a child anymore. I don't have to behave like that. I can learn to behave differently. But if you understand the source, that okay, it wasn't my fault. That's how I adapted to my childhood, to my childhood circumstances. Well, that's a big step towards healing. So the trauma work is important. It's also important because, as I tried to say earlier, trauma is not about the past. It's not what happened the way back then. It's about the wound that I'm carrying now. So I have to look at, and we've talked about this already, how that trauma is showing up right now in my life. So if I'm married, like for example, autoimmune disease, rheumatoid arthritis, multiple sclerosis, colitis, Crohn's disease, fibromyalgia, chronic fatigue syndrome. I could go on. You know who it happens to mostly? It happens to women. 80% of autoimmune disease happens to women. Why? Because in this culture, women are programmed to be very nice and not to be angry and to accept the burden of other people's stresses and to look after their partners and everybody else's emotional needs while ignoring their own. So there's this big mystery. Why does most autoimmune disease happen to women? It's no mystery. It's because when you play that role unconsciously, you're taking a lot of stress. And that stress will impose itself on your body. And that's why you got all this autoimmune disease. So looking at that personal but also collective trauma is essential for healing. So that's why it's important to do the trauma work. Not because you want to feel better in some abstract way, but because by looking at the reality, you're actually helping to heal yourself. Now there's an assumption in that question, which is that you need the permission of the environment to be authentic. Well, that was true when you were 4 years old. It's not, is it still true? So even if you frame the question that way, you're already setting yourself up for failure, because you're giving the power to the environment. The environment may not like it. You might have to find a new environment. But it's not a question of the environment having the right or the power to not to let you. So when you ask the question that way, you're already giving up your power to somebody else. That's not a criticism, it's an observation. Now, how you work towards authenticity is you recognize when you're not being authentic, which is to say you're not being true to yourself. That question already, you need some help to realize, you know what, just by asking the question that way, you're already being inauthentic. Not as a criticism, but as an observation. So the way we move towards authenticity is just by noticing where we're not being inauthentic. And sometimes you need help for that. The person asking the question is asking a very genuine question, but she's not realizing that the question itself is inauthentic because she's giving up her power. Now if she thought, you know, in 2 minutes I could show that to her. So she may need help to recognize, but the question is not how do I become authentic, but how does my inauthenticity show up? The more you recognize it, the more you'll drop it. That's how it works. There's an exercise you can do, which is ask yourself, where didn't I say no this week? Once a week you sit down, pen, paper, where this week did I not say no? Where there's a no that I wanted to say or that wanted to be said but I didn't say it? Oh, when my friend asked me to go for coffee and I was already tired and I didn't feel like it, but I didn't say no. My partner wanted to sleep with me and I didn't feel like it, but I didn't say no because I didn't want to displease them. My boss asked me to take home work for the weekend, but I wanted to spend time with my children, and I didn't say no. My parents asked me to solve some problem that they were having, and I didn't feel like it, but I couldn't say no. I didn't say no. So write down, where this week was there a no that wanted to be said, but I didn't say it? Just write it down. Not judging it, I should have said no. No, just observing it. Where didn't I say no? Secondly, what was the impact on me? That's the second question. What was the impact on me of not saying no? Well, the impact was that I became tired, I became irritated, I lost sleep, I became resentful, I had aching in my back, I had dry mouth, I had muscle tension in my body, I got a stomach ache. That's the impact. Write it down. Third, what was the belief behind my inability to say no? Oh, what's the belief? What's the unconscious belief? If I say no, I'm a bad person. If I say no, I'll feel guilty. If I say no, I'm being selfish. If I say no, they won't love me. Write it down. Those are the beliefs. Not critically, but just as a matter of compassionate inquiry, compassionate observation, which is my method of therapy. It's called compassionate inquiry. Just compassionately ask yourself these things. Next question is, where did I learn this belief? That if I say no, I'm selfish. That if I have my needs, I should feel guilty. That if I act on my needs, I'm a bad person. Where did I learn that? Well, where you learned it is when you were a small kid. That's the next question. The next question is, and you write all these things down. You do it once a week. You take 20 minutes once a week. That's all I'm asking. 20 minutes a week. Are you worth 20 minutes a week? And if you're not worth 20 minutes a week, I'm too busy. Then what are you saying about yourself? You're saying you don't deserve your own attention. Where did you learn that? The next question is, who would I be without that belief? If I didn't believe that if I say no, I'm a bad person, who would you be? If you didn't believe that if I say no, I should feel guilty, if I didn't believe that if I say no, I'm not lovable, who would you be? I'm not going to give you the answer. You ask yourself the question, the answer will come. And then the final question is, where am I not saying yes? Where is there something that I want to do, that I'm passionate about, but because I'm too busy not saying no, because I'm taking on all this stress, I don't have time and energy to say yes to what I really want. Whether that's artistic self-expression, or dance, or drumming, or music, or nature, or love, or gardening, I don't care. Where am I not saying yes? So there's a yes that wants to be said, but I'm not saying it. So that's one little exercise you could do. 20 minutes a week, you do it once a week, I promise you, you start recognizing your inauthenticity, and you're going to automatically move towards authenticity.